You would think that having worked in health promotion, especially around heart disease, that I would have thought that this might be a heart attack. Not at all. The thought never even crossed my mind. And so I'm Dee, and you might have seen the intro video that I prepared a couple days ago, explaining that I was going to be presenting information about living with a chronic illness, in particular, non-obstructive coronary heart disease. I thought the first thing I should talk about would be the actual heart attack itself. And I was going to dive into, living alone when you have a chronic illness, but I thought I should talk about this part first and my whole denial about it. It's interesting because I worked at the Heart and Stroke Foundation for 3 years in the health promotion department. So we were actually promoting the information in schools and information with women's groups and information with doctors. We had a whole kit that we would offer to doctors across the country on helping them talk to their patients about heart disease. So if a patient had high cholesterol, there was a particular pamphlet on dealing with cholesterol and, the signs or the menopause pain. Hang on. The triggers? Not the triggers. The things you have to watch out for. And I'm going to come back to what that word is later, but right now, you know what I mean. The signs? No. Anyway, warning signs, things to watch out for. There is I was doing pretty well. That was a few years before the heart attack. So when the heart attack actually happened, it was during the pandemic. So I had left my office space downtown and I was working from home because couldn't be around people. I still had a really, really busy practice because people were anxious, and that would bring a lot more people to seek out help. So if you haven't listened to the other video, I'm a social worker. So I was working from home, and I would sometimes have 7 clients a day, something like that, between 5 and 7. I would try to have like half an hour between clients, and I thought I was doing well in terms of managing my stress. And in terms of that word that I still can't come up with, I'm going to look that up right now and I'll come right back. Okay, before I hit search, I remembered risk factors. That is what I was looking for, risk factors. I was doing quite well with the risk factors. I had lost weight in the last 5 years or so before the pandemic started. So I was doing well in terms of eating, in terms of exercising. I was exercising a fair amount. I was what I considered to be quite healthy. I journaled, I meditated, I kept in touch with friends. I was doing all the things, but in the background, I had high blood pressure. Actually, the first time my blood pressure was diagnosed was when I was 19 years old. And I just remember the doctor saying, "How can you have high blood pressure? You're 19." It was not treated until I was in my 30s. So I would go to the doctor and they'd say, "Oh, well, it's a little high, but, just be careful." Be careful. Like, look both ways when you cross the street. So my blood pressure was not treated till I was in my 30s, but at this point, since it had been treated, it was normal. Every time I'd go to the doctor, they'd say, "Oh, your blood pressure's perfect." It was just, it fixed it, it was managed. So I wasn't worried about my blood pressure. But about, say, a couple of months before this whole thing started, I was exhausted. So I was very tired all the time. And I figured, well, I'm working a lot and it's stressful because of the situation, because of the pandemic. I mean, everyone is freaking out and stressing out. So it makes sense that I would be tired and I would be stressed. I didn't really, when they say, watch out for your stress, or be careful with your stress, or handle your stress. There's things we can't fix. You can't necessarily, I couldn't just quit my job. I was doing the things to try to manage my stress, and I thought I was doing it well, but in the background, I guess it was still affecting me. But generally, I was what I consider to be healthy. The day of the heart attack, I was working, and I had already seen like four clients, I think, and I had had a headache all day that day. And I also forgot to mention that I had pain in my left shoulder blade for at least a week. And I thought I'd pulled a muscle or something. So the pain would come and I would do some stretches and I would take some Advil and I'd put some, hot, cold cream on it, and it would go away. And then maybe 6-7 hours later, I'd have the pain again and I would do the same thing. So I was making it to be, it's a muscle ache. So fatigue, pain in my left shoulder blade. The actual day, and also along with the stress, I had heartburn, or I felt nauseous constantly. And, I just dealt with that by taking 2-3 Tums whenever it would get bad. And I had the bottle on my desk. So that day, headache, I had a pain in my neck. And I've had headaches since I was a kid. So I've learned to live with headaches, and I can still function unless it's a full-blown migraine. So I worked through the day with this really bad headache. And when I was just in that 4th appointment, during the appointment, I had a huge wave of nausea. And I was trying to listen to the client and not make it look as though I was feeling really ill, but I was trying to look like I was paying attention. And in my head, I'm like, don't throw up, don't throw up. So I managed to get through that appointment. And I had an hour to myself before the next appointment at 5. So I finished at 4 and my next appointment was at 5. And I hadn't eaten anything since breakfast, and it was now 4 o'clock in the afternoon. So I had a banana, and the nausea and the headache were still there. But all of a sudden, the pain in my shoulder came back really strong. And I also had a pain sort of in the middle of my back. And it felt like if you take a bite of something that's too big and you feel that it feels like it's stuck in your esophagus, like you get like a point, like I'd swallowed a golf ball. And it was really painful. And I thought, what the heck is that? Like the only thing I'd eaten was a banana, and it wasn't. So I thought that was strange. And then I started to have pressure in my chest. You would think that having worked in health promotion, especially around heart disease, that I would have thought that this might be a heart attack. Not at all. The thought never even crossed my mind. And it's almost as if I kind of left my body a little bit. I was super calm. I looked at the time. I took my blood pressure because I had been taking my blood pressure a lot recently, because in those 2 weeks leading up to this, my blood pressure was very high. And I just figured it was what I was dealing with. There were some issues where I was living, and there was a lot of like annoying things that I had to deal with. So I just thought, well, that must be what's making my blood pressure high. So it was like 160 something over, I forget, but it was high. I had never seen that number before. But I took my blood pressure. I snapped a picture of it. And I had this pain, but it wasn't like a crushing pain like you see on TV, It was just a pressure. And like I said, the pain in my shoulder was worse than that. And then all of a sudden, my left arm felt dead. That's the only way I can explain it, because I've never had that feeling before or since. But it was almost as if I couldn't even move it. Like it just felt like it wasn't attached to me. Like it was a very strange feeling. It felt weird. And so I had a fleeting thought, oh, maybe it's a heart attack. But I shut that down as soon as I thought it. And I was paying attention to the time. And this whole little episode lasted about 35 minutes. And the thing I didn't mention is when the chest pain happened, the headache went away. Like it was replaced by the chest pain. So that event lasted 35 minutes. And I thought, well, that was strange. But then I felt fine. So no reason to not see my next client at 5 o'clock. So I went back into my office and turned on my video and had the appointment with the client. And I was fine, and I was paying attention to her, and it was mostly a regular appointment, except that I saw myself in the video. And I had the thought, gee, you're looking a little pale. But I pushed through the appointment and I finished it. And almost as soon as the appointment finished, I started to get pain again in my chest. And so I was trying to figure out what else could it be, because it's not a heart attack. And I remembered that I had a friend who had had a gallbladder attack, and it was similar feelings. Like she had nausea and she had chest pain and all this stuff. So I texted her and I said, so what were your symptoms when you had your gallbladder attack? I'm totally calm as I'm doing this, and she's like, oh my God, I thought I was having a heart attack. She said, you need to go to the hospital. So I said, okay. And I'm thinking, oh God, do I want to go to the hospital? Like, I'm going to go there, I'm going to wait about 12 hours. I'll see someone, they'll tell me everything's fine, and then I'll go home. So I very reluctantly got my neighbor to take my dog out at about 9 o'clock, because I thought, well, I won't be back by 9, because it was about 6:30 by now, 7. And so I gathered a few of my things, and I thought, oh, I should do the dishes before I go. But there was another little voice in my head that says, no, you need to leave now. Did I call an ambulance? No. I called an Uber. I wasn't having a heart attack in my mind, right? So I took an Uber and got to the hospital. And when I got there, I had barely any pain. So when they asked me why I was there, I said, well, I've had this pain in my shoulder blade. And they also took my blood pressure, and they said, well, your blood pressure is a little bit high. They did an ECG, and it was fine. So they didn't seem too stressed or worried or anything like that. So like I said, I arrived at the hospital about 7:15, and I saw the doctor. This is where it starts getting blurry. I saw the doctor, I think, around 10:30, 11. And I was telling him I had this pain in my shoulder, and he looked at my shoulder and he says, I don't know why it's hurting. And he said, any other symptoms? And of course, we're in the middle of COVID. So I said, well, I have been coughing a little bit, because he was asking some of the COVID symptoms. So he said, well, I'm not sure what's wrong. He said, but we're going to do some blood work, and we'll do a COVID test, and just go to the waiting room and stay there until the nurse comes and tells you that everything is fine. Okay. I was in the waiting room maybe 20 minutes. I get an alert on my email, and I check it, and it's my blood work results. And I look, and there's this thing that I'd never seen before called Troponin. And it was flagged as high. So, and I'm reading underneath it that, higher levels in this could indicate myocardial necrosis. And I'm like, what is that? So I'm Googling necrosis, which is basically like dead muscle, dead tissue. So I didn't get a chance to really look at all this up when I saw the nurse coming towards me. And she said, oh, come with me. And I could tell that she was wanting to keep me calm. And she just said, well, we're concerned about your blood pressure, and we just want to keep an eye on things. So we have a bed for you here. And the cardiac team's going to come and see you. So I was like, okay. So I had already started to leave my body when this whole event was happening. So that kind of secured it. I was watching the whole thing. I was super calm. I wasn't afraid. And there was someone at my bed every 20 minutes. They were putting in a heparin IV. They were putting in another IV to draw blood work. They were giving me medication for my blood pressure. I had another bedside ECG. That one was not normal. And then I don't even know who came to see me. I think it was the doctor and the cardiac resident. Like, it wasn't the other cardiologist. It was another one of his residents. And she did a bedside ultrasound. And I'm just kind of looking at them, and the doctor said, well, you've had a small heart attack. Now I think it's funny when they say small. That's all relative. And I'm like, okay. And they kept checking on me, make sure everything was fine. I'm texting, I texted the friend who told me to go to the hospital, and I said, oh, by the way, apparently I've had a heart attack. And she's like, oh my God, like I can watch your dog if you want. And I'm like, well, hopefully I won't be here long. Denial. First part of denial. And at this point later, it was getting like, we're getting close to midnight. Maybe later. I think at this point it was like 2 in the morning when the nurse said, do you want us to call your next of kin? And I said, no, I'm not dying right now, am I? They must have thought, oh boy, we're going to have fun with this one. I said, no, don't call my sister in the middle of the night. I'll phone her in the morning. And then the cardiologist came by, and he just stood at the foot of my bed because there were still like not a lot of touching of the patients, right? COVID. And he said, oh, we're just waiting for a bed for you at the... So I just looked at him and said, well, how long am I going to be? Like, I'm moving in a week. Like, that was another one of the stressors, is I had planned to move. I was just about to start a 1-week vacation to pack up my apartment. And I was going to be moving a week from that day. And I'm sure he was laughing to himself, like, yeah, right, you're moving. Anyway, I ended up admitted at 6 a.m. And troponin is the blood marker that they check to see if there's been any damage. It checks for cardiac proteins to see if there's been any damage to your heart. So elevated troponin is usually one of the things that helps determine if someone's had a heart attack. So that was my first element of surprise. And I guess there's a few things about that are lessons, you know. Call an ambulance. If you're unsure, if you're having pain you have never had before and it's weird, if you're unsure, call 911. This might not apply to people in the States because I know how expensive ambulances can be for you. But if you are in Canada, call an ambulance. And the reason for that is they can monitor you from the moment they arrive at your house. So they can put the monitors on you. They can provide you with nitroglycerin, which helps open up the arteries. They can give you oxygen. They can do all these things on the way to the hospital. But if you ask, you know, your husband, your wife, your cousin, your neighbor to drive you, they might be nervous, and you don't know exactly how you're doing in that moment. So anything could happen. So take the ambulance. So that was one of the things I learned. And I will get back to all of the other lessons in another video. But I just thought I would share this little story, how even though I thought I was healthy, the only risk factors that I was aware of was my stress level and a history of high blood pressure. I thought I was doing all the other things right, and there is no obvious heart disease in my family. I don't know anyone who's had a heart attack like caused because of their heart. There's a lot of diabetes in my family, but even none of the people with diabetes have had heart attacks. So I kind of thought, that's not going to happen to me. I'm at higher risk for cancer, mental illness, one of those, but not heart disease. And they asked me that when I was admitted. They said, anyone in your family have heart disease? And I'm like, no. So, you know, yes, heredity. Anyway, that thing about inherited genes. can play a factor, but you can also have something out of the blue. So don't necessarily count that something might not happen to you because it doesn't run in your family. I will stop it there for today. If you have any questions about what I just described, please feel free to share. And if you had your own experiences of having a heart event and being in denial, please share that as well. I'd love to hear from you. So take care. You're not alone.